By now you've heard a lot about healthcare reform, the Affordable Care Act, or Obamacare. But what does that really mean to us as a health system, or more importantly, what does it mean to you? Hi, I'm Shawn Evans, Senior Vice President for Performance Excellence for UC Health. And although we don't have all the answers yet surrounding healthcare reform, we are learning more and more each day. I'd like to spend just a few minutes today talking about some of the things that will change in our world as a result of healthcare reform. Most people think that healthcare reform is new, but in reality, there are references to healthcare reform that date all the way back to Thomas Jefferson and John Adams. In the 1960s, the Center for Medicare and Medicaid Services was established to help provide better access and payment to care, all the way through to 2010 when the Affordable Care Act was established. So one part of healthcare reform that's been in the news a lot recently is the requirement for everyone to purchase health insurance if they don't already have coverage from their employers, from Medicare, Medicaid, or another program. It's estimated there are about 32 million people, almost the same size as the population of the state of California, who will be affected by this mandate. This is expected to affect the way people access care, and it will impact the way in which we're reimbursed for providing that care. In the United States, we operate on what's called a fee-for-service model. What this means simply is we are paid based on the things we do for our patient. Moving forward, though, one of the key tenets of healthcare reform is to move into a model that reimburses healthcare for the value we provide to our patients. So what does value look like? It looks like the quality we provide, the level of service, and the way in which we do it in a cost-efficient manner. So these two graphs actually help explain why we're going through all this healthcare reform stuff. On the left side, what you're looking at is the amount of money we spend per person on average in the United States each year on healthcare. It's about $8,000. Take that in relation to the other countries on this graph, and it's almost double. On the right side, you're looking at the total percent of money our economy spends on healthcare. It's almost 20%. The way people pay for healthcare has changed dramatically over the past 40 years. In 1970, most people paid for healthcare out of their own pocket. In 2010, the majority of healthcare is being paid either by private insurance, Medicare, or Medicaid. So now that we've talked a little bit about how healthcare reform has come about, let's talk about what it's trying to do. At the bottom line, it's trying to reduce the amount of money we spend on healthcare by $2 trillion. So how do they propose to do this? There are a lot of things that are in the Healthcare Reform Act, but let me focus on just a few. Number one, value-based purchasing. What value-based purchasing simply means is that Medicare is going to withhold a percentage of their payment to hospitals each year, and that percentage increases for the next 4 years. So Medicare will return that money based on a hospital's performance. So if a hospital performs well, if they are above average, Medicare will give the amount of money they withheld plus a little bit. If a hospital does not perform well or below average, Medicaid will not return the full amount to that hospital. And here's what it looks like. 70% of what Medicare is withholding is based on the way in which we provide care. They're called processes of care, things that we do for our patients. 30% of that money is being withheld based on the level of service we provide or patient satisfaction. So hospitals are now being measured both on what they do and how the patient perceives that level of care. Going forward, that percentage changes. So then we're looking at not only the way in which we provide care, the patient satisfaction piece, but we're looking at outcomes, we're looking at efficiency, and we're looking at the process of care. Another thing is called bundled payments. So currently, if you go into a hospital, you could receive a bill from the provider, from the hospital, from lab, from imaging, from the anesthesia, and the list goes on and on and on. Not only is this confusing for patients, it's also a very inefficient way to pay for care. Going forward, the proposal is there'll be a single payment for every episode of care. So one thing that you're probably seeing is a change in the way people are getting their care. More and more people are getting care in an outpatient setting. What this allows for is people to receive the right amount of care at the right time, which can be a more cost-effective way of providing health care. So if you're planning a trip, you're probably going to go onto a website like Expedia or Travelocity, type in where you're going, and see all the different options you have to get from point A to point B. People currently cannot do that when they choose healthcare. So one of the things healthcare reform has done is forced the migration to an electronic health record. So what this means, in addition to patients having much more access to their own health records, payers, insurance companies, Medicare, Medicaid, are going to have access to much more data than they've ever had. The data includes quality, it includes outcome, they're going to have cost information, and they're going to have patient satisfaction. All this information is being loaded on the web, which will allow consumers to make much more informed choices about how and where they get their care. After all, don't you think it's as important to have as much or more information about where you're going to get your health care as it is on where you're going to go on vacation? So what does all this mean? First, much more information is going to be available on our levels of quality, patient satisfaction, and cost. Second, the way we get paid is going to be based on those levels of quality, patient satisfaction, and cost. And third, consumers are going to be able to make much more informed choices on where they get their care. So, it's up to us to provide the very highest levels of quality, the most excellent service in a cost-efficient way so that University of Colorado Health remains the place that patients come to get their care.